AHFoZ, you oversee these various medical aid societies in Zimbabwe, and there has been an outcry in regards to the packages, in regards to the service that is being rendered, the issues of topping up, the issues to do with the shortfalls, and all that. As AHFoZ, how are you addressing these challenges?
So, as AHFoZ, amongst other things, we regularly review tariffs. The challenge at times is that service providers may review their fees according to their own costs and according to what they think they should actually be paid. But the challenge is that medical aid societies are not always able to absorb fees that are increased at frequent intervals, simply because the money that medical societies use to pay healthcare service providers actually come from contributions that are made by members. And members are not getting any increases in their salaries, or they are not getting frequent reviews of salaries. Quite a number of medical aid members are still earning in local currency, which is the ZiG. So some service providers choose to charge in US dollars for most of the services, and some then would opt to collect shortfalls, which may be in US dollars. So that poses a challenge on patients who will be seeking healthcare services, in the sense that they have to pay out of pocket, and people don't always have cash. I've just said that salaries are not reviewed that regularly. So at any point, members do not have the extra cash to pay out of pocket, and they do not have the capacity to have their contribution increased by the medical aid. So it's a challenge. That's why at times we find that some members, maybe who have relatives out of the country, may opt to go and seek treatment outside the country. Some may opt to defer treatment because they cannot afford to pay the shortfalls out of pocket. So there is actually need to align maybe the incomes. There's need to look at the income levels of the people, and then to what extent are they able to absorb contribution increases, so that those contribution increases may then also be passed on to healthcare service providers. So we are constantly trying to strike a balance between ensuring that service providers also are viable, because the idea is not to push healthcare service providers into poverty. We don't want them to leave the country. We want them to be able to continue giving a service in this country, and we also want patients to be able to access services. But at the same time, we mustn't kill, they say, the goose that lays the egg. The medical aid societies should also remain viable. Employer organizations, or whatever the source of the contribution, should continue also to be viable.
Well, considering the current situation in regards to inflation, as the regulator, you're very much aware that the ZiG currency is actually been stable for a period of some time, and it is a positive change in terms of payments and co-payments and stuff. As the regulator, what do you have in plan ahead, as you have got this whole issues and challenges in regards to medical aids and services, as well as funding? Mind you, the larger part of the economy is the informal sector, and it's largely surviving on out of cash cash payments. So as the regulator, what do you have in plans, considering the stability of the currency?
Well, AHFoZ is not really a regulator as such.
Yeah.
We are self-regulating.
Yes.
But what we encourage our members to do is to embrace whatever currency is being used by their members. So we deal in all currencies. Every Zimbabwean should be able to pay for medical aid society contribution using the currency that they have at their disposal. And we are happy that the ZiG has been stable. We hope that it remains stable. because that would then enable more members to stay on medical aid and to make medical aid more affordable.
Yeah, how many, like, in 2024, the beginning part of the first quarter, and part of 2023, how many complaints have you received in regards to the service, accessing service and so forth, regarding to, in line with the medical aids societies in Zimbabwe?
Unfortunately, most members of the public do not make formal complaints. We then just pick these things maybe from the media or accidentally, but unfortunately, most people do not make formal complaints because that formal feedback would actually assist us in appreciating the situation on the ground.
Do they know how to make these complaints and where to make these complaints? Do you have contact? Do you have anywhere where they would find that information to bring issues to your attention?
Normally, the first port of call for members is their own medical aid society. But if they have complained to their medical aid society and there is no joy, they can either complain to AHFoZ and they can visit our website where we have our contact details and then we can assist them. Otherwise, beyond reporting to AHFoZ, the next port of call would be to escalate it to the Ministry of Health, because the Ministry of Health is the regulator of medical aid societies.
Well, just in conclusion, just give me an overview of your sensitization and awareness programs in regards to the access of service, medical aid societies, and all these issues that you've been discussing.
We usually run public awareness campaigns on our social media platform. We've got a Facebook page and we've got a LinkedIn page as well. And regularly we also put articles in the print media, but mostly every day there will be an article on our social media platforms. So it would be good if members of the public can like our pages and follow, so that they don't miss out on articles that we publish on those social media platforms.
Thank you very much, Ms. Sanyanga.
Thank you.